Welcome to the fourth and final episode of You, Me, and HAE. I'm your host, Debbie, and joining me today is Aaron. He's an avid reader and writer who also happens to have hereditary angioedema, or HAE. HAE is a rare disease caused by either the body not making enough of a protein called C1 esterase inhibitor, often just referred to as C1 inhibitor, or when the body makes enough but it doesn't work right. This results in periodic swelling that can be painful, unpredictable, and life-threatening. This program is sponsored by Farming Healthcare Incorporated. The speakers have been compensated for the presentation of this information. The information contained within this podcast is for educational purposes only and is not intended to be medical advice. This episode will discuss experiences of people living with HAE. It is important to recognize that these experiences may not be representative, as every person with HAE has a unique disease course. So, hi, I'm Debbie. I was diagnosed with HAE type 1 about 10 years ago. I'm the proud mom of 4 beautiful daughters, 2 of which also have HAE, and I have a handsome rescue dog named Bo. He is the sweetest dog you will ever meet. In these podcast series, we will exchange personal stories about living with HAE and how the disease can impact daily life. We're going to explore challenges with having HAE and approaches to overcoming them, especially leaning into your available support network. We'll also discuss approaches that may be helpful when engaging with your healthcare provider about HAE and HAE treatment options. This episode will highlight one patient's journey with HAE and how they continue to manage HAE swells with on-demand therapy even while receiving prophylactic treatment. On-demand treatment is the medication you use once a swell starts and can also be referred to as a rescue therapy. So with that, I'd like to introduce you to our guest today. Aaron, tell us a little bit about yourself and your HAE diagnosis.
Hi, my name is Aaron, and like Debbie mentioned earlier, I love to read and I love to write. I love it so much that I have a home library that is almost 2,000 books. I've also authored several books of poetry and one novel that's published, and I enjoy very much spending time with my family and my little granddaughter, who's now 7 years old.
And I will just say that I've had the privilege of reading one of Aaron's books. It was actually about a person with HAE, and he is a great writer and has brought a lot of thought to that topic in his book.
Well, thank you. And that book actually now has a sequel out.
Oh,
Well,
really?
it's not out, but it's finished,
Oh,
sort
okay.
of. I have to
Okay.
edit. It'll
I
take a
look
while.
for I look forward to reading that one too.
I look forward to having it done. Thank you.
So, tell us more about your HAE diagnosis.
Well, in terms of my HAE diagnosis, I've been experiencing symptoms for over 4 decades. I can remember having very painful, terrible stomach swells when I was about 5 or 6 years old. And that pain was so severe that it got to the point where I couldn't walk. Following my mother's diagnosis, my siblings and I were tested for HAE type 1, and I was 12 years old at the time. And one of my siblings and I both tested positive for HAE type 1.
So, Aaron, wow, I've met other people who have had similar experiences to yours, but thankfully, you did not have to wait as long as other people. Your mom waited a long time, but then because of her diagnosis, you didn't have to wait.
That is correct.
As a reminder to everyone listening, HAE is a rare disease that's characterized by swelling episodes. Swelling in the body is controlled in part by a protein called C1 esterase inhibitor, often just referred to as C1 inhibitor. And when your body doesn't produce enough C1 inhibitor or produces C1 inhibitor that doesn't work properly, the processes that cause swelling are overactive and they lead to HAE swells. That's why HAE is sometimes referred to as a C1 disease. The swelling experienced during an HAE episode is from fluid in your blood vessels leaking into other tissues. So, after finding out that you had HAE, how did you feel, Aaron? What was your journey like to find treatments?
Although I don't remember when I was diagnosed with HAE how I felt, I do remember that it was nice to have a name put to what I was going through. since I've had HAE my entire life and dealt with it from such a young age, that's all I know. I do know that I'm grateful to still be here. I do remember that having the diagnosis of HAE at the time did not change how I dealt with my HAE swells. Back then, all I could do was power through the pain. There were very few treatment options at the time. And once I found out there was new treatments out there, it took a while to understand that they really are there. I participated in a clinical trial for an investigational HAE on-demand treatment. The treatments that I tried didn't improve my situation much, and in some cases I experienced side effects. I also had difficulties finding doctors that knew a lot about HAE. And back in 2015, I attended my first HAE patient summit that was sponsored by the U.S. Hereditary Angioedema Association. And at that time, I understood that there were new medications available that were approved by the FDA to help manage HAE swells. That first convention was an eye-opener for me and allowed me to connect with people who have HAE other than my family because I'd never met anyone before. And at that time, I felt validation in people that knew what I was going through and knew that it wasn't in my head and I wasn't crazy and the symptoms that I was experiencing were real.
Aaron, that 2015 summit is the first patient event I went to as well. I wonder if we met back then. It would be interesting to know, but it is a huge thing to walk into a room of people and realize that they understand exactly what you're going through like nobody else can. So a room full of strangers when you enter, but then you have all these new friends when you leave.
Yep, you walk away with friends every time.
That's true. So, what about now? Have you found a medication that works for you? And what keeps you motivated to keep searching for answers after all this time?
The motivation that I have right now is my two girls and my granddaughter. I want them to avoid what I've gone through most of my life. And I have found medication that works, but I still keep doing things and like this podcast, for instance, and I still keep, I'm willing to help further research and education so that not only my girls and my granddaughter, but other people don't have to go through some of the things that I've been through. I've been on a prophylactic treatment intermittently since I was 18 years old, but it was never enough to keep the disease under control to a point that I felt comfortable with. It is important to keep in mind that prophylactic treatment and on-demand therapy are different. Prophylactic treatments are prescribed to help prevent swells from occurring in the first place. On-demand treatment is used to treat a swell when it happens anyway. And while on prophylactic treatment, I still continue to experience painful breakthrough swells and therefore decided that I need an on-demand treatment that works for me as well.
So, yeah, Aaron, even though you're on prophylactic treatment, HAE patients will continue to have breakthrough swells, and it's important to have that on demand treatment as well. So, tell us about your search for an on demand HAE treatment.
Well, my search for on-demand treatment actually started a number of years ago. I was working with a doctor, but for on-demand treatment of RUCONEST, but then for personal reasons, my family and I had to relocate across the country. And I did not follow up with the new doctor. I hadn't found one yet. And shortly after we got to our new location, I was hospitalized because of HAE swelling. And ironically, one of the doctors had worked under the doctor that I now see for my swelling. To be honest, though, when I was starting RUCONEST, I was a little bit nervous about it. And I was telling this new doctor about my concerns. And he came up with a solution and said, let's try it at the hospital that's across the street. Like, okay, we can do that. And so we had planned a day where he could be there if needed. And I woke up that morning and my face was swollen. And I'm like, okay, we're gonna see if this works. We're gonna see if I have an adverse reaction to it. We're gonna get some questions answered. I went to the hospital and after getting the RUCONEST, to my surprise, it worked. And I was pleased because it stopped the progression of the swell in my lips.
Just so that our listeners are aware, RUCONEST, C1 esterase inhibitor, recombinant, is an injectable prescription medicine that is used to treat swelling and or painful attacks due to hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12.
Debbie, as a fellow person prescribed RUCONEST, I'm curious, how did your doctor first describe RUCONEST to you?
My doctor first told me how RUCONEST works. I learned that RUCONEST increases functional C1 inhibitor, addressing the root causes of an HAE swell. I found out that RUCONEST is dosed at 50 units per kilogram with a maximum dose of 4,200 units. Also, no more than 2 doses should be administered within a 24-hour period. Then my doctor shared efficacy data for RUCONEST. In the clinical trial, about 9 out of 10 patients successfully stopped an HAE swell with just 1 dose of RUCONEST. The study included 44 patients. In the open label extension study, 44 patients experienced 170 HAE swells and received RUCONEST. In this study, 97% of swells needed just 1 dose of RUCONEST. In the primary clinical study, patients saw symptom relief with RUCONEST in 90 minutes versus 152 minutes in the group taking inactive liquid. My doctor always lets me know the safety information. In clinical studies, anaphylaxis was a serious adverse reaction that was reported. This serious event happened in a healthy volunteer who did not reveal their known rabbit allergy. The most common side effects that patients experienced were headache, nausea, and diarrhea.
In addition to the safety information you already shared, is there anything else people considering RUCONEST should be aware of?
Of course, my doctor also shared with me that I should not use RUCONEST if I have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis to RUCONEST or to any other C1 esterase inhibitor product. She emphasized to call the doctor's office or the emergency department right away if I experience wheezing, difficulty breathing, chest tightness, turning blue, looking at lips and gums can be an indicator, fast heartbeat, swelling, faintness, rash, or hives. A serious side effect of life-threatening hypersensitivity or anaphylaxis was reported in a clinical study. I learned that you are not to use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. It is always important to tell your doctor about all your medical conditions, including if you have a known allergy to rabbits. Before starting RUCONEST, I told my doctor about all of my current medications, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. It is important to note that blood clots have occurred in patients receiving plasma-derived C1 inhibitor product. Also, be sure to tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experienced during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. My doctor encourages me to tell her about any side effect that bothers me or does not go away. I can also report negative side effects to Pharming Medical Affairs at 800-930-5221 or contact the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. If symptoms persist, a second dose of RUCONEST may be taken at your recommended dose, but you are not supposed to take more than 2 doses within 24 hours. For more information, please see the full prescribing information, including the patient product information, which is available at www.ruconest.com.
After weighing all the risks and benefits, my doctor and I determined that RUCONEST was right for me, but all patients with HAE should talk to their doctor to see if RUCONEST is right for them. So I've been on RUCONEST for the past 6 years. As I was explaining in my history earlier, I had spent so many years powering through the pain that I'm still learning to appropriately use my current on-demand medication. On-demand treatments are recommended to be used with early signs of swells. However, I sometimes inadvertently delay treating a swell, yet RUCONEST still works for me. RUCONEST has helped provide me symptom relief once an HAE swell has begun. Since I started using RUCONEST, I've been able to administer my treatment at home and have not needed to go to the hospital.
It is a huge relief as a patient to know that we have medications that can treat our HAE swells. And now that you do have a treatment regimen that includes RUCONEST and a prophylactic medication, what's your experience been like?
I'm still experiencing swells frequently, about once a week, while on my prophylactic treatment. However, to me, this is still progress. RUCONEST has provided me symptom relief when I do experience HAE swells, including areas of my body that have historically been difficult to manage. My doctor was very clear that prophylactic treatment does not completely prevent all swells and that I still needed my on-demand treatment to address swells when they happen. He emphasized the importance of keeping at least 2 doses of my on-demand treatment readily available since swells can still happen at any time. Based on my history, I expected that I would still have swells, even after starting prophylactic treatment. For me, prophylactic therapy has only slightly decreased how often I have swells. You may hear your doctor refer to swells that occur while you are on a prophylactic treatment as a breakthrough swell. In fact, one research report looked at 244 patient medical histories and found that 30% of people with HAE using prophylactic treatment had a swell within the past month. When I do have a breakthrough swell, I try to administer my on-demand treatment as soon as possible, regardless of where it is happening on my body. Since I have been on prophylactic treatment, it remains important that my on-demand treatment can reliably relieve my swells with just 1 dose and that it can work for a range of swell types, especially severe ones.
Right, Aaron. Every patient with HAE has a different path, and I am glad that you found the treatment course that works for you. When you are tracking your swells, what information about your swells have you found important to track? What information about your swells do you discuss with your doctor? And do you have any advice for new patients dealing with HAE?
I would definitely advise new patients to keep track of their swells until they know what triggers them. It's also important to track swells to determine whether their treatment is working. In the past, I have found that the HAE and Me app was the best tool to track my swells. I would document the date and time, as well as the anatomical location of swell and the overall severity of the swell.
I also like using the free HAE and Me app to log my swells because it helps me give more accurate information to my doctor. I can say, I had a swell on March 14th instead of, I think I had a swell sometime in the spring. And another thing that can be helpful with that app is taking pictures of your swells to show the doctor. So, Aaron, it is wonderful to hear about your HAE journey. Is there anything that you would like our audience to remember from our chat?
Yes, Debbie, I would want people to know that there is hope. I hope that there is even more to come. Although this is not easy, I don't consider my HAE as a punishment. I really hope that my experiences can help someone dealing with this rare condition, especially my children and granddaughter.
Aaron, that is really true. Sometimes when you get diagnosed with a rare disease like this, you look only at the negative things. But I've actually found positive things about having this as well. It's helped me find my voice, helped me learn to advocate for myself and for the things that are important to me. Aaron, thank you for your insightful conversation and being open to discuss how you manage your HAE while you're on a prophylactic treatment. Listeners, thank you for tuning in and engaging with us. This is the final episode in our series, but if you are interested, you can find additional resources about HAE, RUCONEST, and upcoming educational events at ruconest.com.